Matthew Holt here, and delighted to be talking with Bret Galloway. Bret is the Senior VP of Marketing Communications at Trinity Health, which is a very large system that came out of a merger in 2013. So Bret, explain to me a little bit, for those people who don't know, what Trinity Health is and where you are.
Trinity Health is a Catholic health system. We're based in Livonia, Michigan, and we have regional health ministries throughout the United States. We have about 86 hospitals, more than 100 continuing care facilities. We have home health and hospice serving about 2.5, 3 million people every year, 2.5, 3 million visits anyway. And we're in 21 states now. Our mission as a health ministry, national health ministry, is to be a healing and transforming presence in the communities we serve. I'm happy to do that throughout the country.
Great. And you have regional concentrations that, we'll be more likely to see your hospitals and physicians in one place versus another?
Well, we do. We're not in every single state, but we certainly go all the way from California up into New England, down to Florida, a big concentration along the eastern seaboard and the Midwest, Ohio, Michigan, Iowa, but really very much nationwide.
Great. So, fascinating, because you are one of these new emerging sort of super regional hospital organizations, and obviously when you talk about your changing and merging, and you're relatively new CEO, Dr. Richard Gilfillan, whose name I'm always mangling, but used to be at the CMS Innovation Center. We were kidding earlier that he was the guy who managed to miss his appointment slot to talk at Health 2.0 once because he was in a busy conversation somewhere else. The interesting thing is that while you're merging and creating a new transformation for yourself, the healthcare system is obviously changing around you and the demands are changing. So that's why we're here to talk a little bit, because we're here because you guys have made both an investment and are a customer, and will be a bigger future customer in Sharecare. And obviously Sharecare is a consumer-focused website with the connection with Dr. Oz and Open and all the rest of that, but it's also providing a bunch of other services. So what was it about Sharecare, and what are the sort of broad functions that they're helping you with that are important for Trinity?
Mm-hmm. Well, Matthew, let me step back, give you a little context in turn that'll help understand why we partnered with Sharecare on a couple different initiatives. So I mentioned we are a Catholic health ministry with hospitals, 21 states and 86 hospitals around the country. And part of our mission is to be a transforming healing presence in the community. So our communities have about 30 or 35 million people, but only about a fourth or a third of those actually go through our facilities, go through our hospitals and our continuing care. So if our mission is truly to serve the entire community and not just those 20 million people who are coming through, 10 million people who are coming through the doors of our hospitals and continuing care, how can we reach the other 20? So obviously a big way to do that is digitally. Now, 150 years ago, when the nuns started our hospitals, they were able to reach out to the community by meeting them at the schools and at their houses and at the churches. We can't do that anymore. It's a much bigger population. So the solution is to go digitally and try to reach them in that community because we know they're there. So Sharecare has a community already throughout the country, and it's one of the strongest, broadest platforms that we've seen for consumer engagement. They have about 15 million active users across the country, including about 3 or 4 million in our markets. So we're partnering with Sharecare to reach out to people in our markets in a very big way to help connect them with their wellness and with their health, live healthier lives, learn more about their well-being. And in doing so, one of the other great advantages of Sharecare is once we connect with those people, we can then connect them with a physician or with a clinician or with a hospital or continuing care facility, somebody who can help. So first of all, it's just engaging people in their wellness, people who might not be seeing a physician at all, and then connecting them with someone who can help them even more.
So in terms of that connection, what do you think? I know you're rolling out a new portal and some other aspects in terms of that sort of patient engagement. Obviously, one is just general wellness and information about health. But in terms of actual connection, what are the kinds of technology services that are going to be using on the Sharecare platform, and how is that working with other tech services that you're building both inside your hospital and elsewhere?
Sure. Yeah, so we're going to be launching next year. Well, we've already started launching it in some pilot sites now. But in earnest, we'll be launching next year. Our portal is called My Health. And there's 4 elements of that. And we really see this as the home base for all of our digital interactions with consumers and with people who are patients today. So the first part of that is what we call your health record. That's your EMR, right? Your electronic health, your electronic medical records. And it's that information that Trinity might have in one of our hospitals or one of our physicians about you. But it's also Sharecare. Sharecare, you go in through the Real H test and you provide that information on your own. So a key element is being able to integrate those so you can see the information that you've provided through the Real H test, as well as the information with Trinity Health. Another part is what we call My Care Team. That's care management. That's reaching your physician. It's making an appointment. That's another part of My Health. And we know that Sharecare has some expertise in that area. Then there's what we call My Money. Okay, it's the money section. It's paying your bills, seeing an invoice, learning about your interaction with your insurer. That's a big, our research has shown us that that's obviously a big part of where people need help online, and digital is a great place to do that. And then finally, we have a piece called My Marketplace. If you need to buy medicine or if you need to purchase something related to your health, whether it's buying crutches or getting some kind of information, this is a little more aspirational for us, but that's another element. So we do see some connection points there with Sharecare, certainly with the My Wellness piece and connecting with the Real H test and helping people understand their health and then connecting them with the right physician or the right clinician or the right facility, but also scheduling. We know that Sharecare has some great technology there and some great understanding with how the industry works.
So final question. Once this is built out, and obviously this is more than aspirational now, you've now got a plan and a roadmap and a partnership to be doing this, and you're a big presence. You're not the only guys doing this, of course. Many other people from the clinic side to the big academic medical centers to other chains are doing this, and some of them are working with Sharecare, some are working with other people, some are doing it themselves. How do you think that will change what a mission-driven organization like yours does? What do you think you'll be doing, and what do you think the sort of center of a Trinity will be in 5 to 10 years compared to the more hospital-focused efforts you have going on now?
Well, there's a big opportunity for population health. Right now, we're focused on the individuals and helping find people and helping connect them with the information and with the clinicians who can help them. But as we get more people connected with us and connected with Sharecare, more people interacting with that wellness platform, then we can see trends, we can see interests, we can see the kinds of medical symptoms or the kinds of diseases that people might be asking about and questioning about. And when we really get traction and we really get large numbers interacting, we can look in different neighborhoods, different cities, and find out what the interests are and what the issues are. We can find out when we can find out, so diabetics are asking this question. And then we can serve, rather than just that one person, we can serve an entire population. And that's what really is exciting to us about Sharecare. And we're excited about patient acquisition opportunities. We're excited about helping individuals and connecting them with physicians and with clinicians. But really for us, the more we can help large numbers of people, help an entire community, and watch the trends and be able to be proactive in helping communities be healthy so that they never get sick to begin with. That's the big return for us on making as many people healthy and happy as possible.
Right. So I think that's an auditory goal. I hope that we capture a little bit of the sort of the excitement that you've got there, working with Sharecare and sort of changing essentially what you guys are doing generally. That's fantastic. So I've been talking with Bret Galloway.
Thanks. We're excited about it.
He's the SVP of Marketing Communications at Trinity Health and working with Sharecare. So Bret, thanks for your time.
Thanks, Matthew.